Welcome back to the Better Birth Podcast. I'm Catherine, the founder of Anja Health, and today we are with Anna Lee Reed, who is a certified midwife based in New York City. So super excited to have you. Thank you so much for being here.
Yeah, thank you for having me.
Awesome. Would you like to give a bit of background on yourself and especially how you got involved in midwifery?
Sure. So I am a certified midwife, as you said. I actually started midwifery as a certified professional midwife. So I went to school to become a certified professional midwife in 2014.
Wow.
And on that journey, so certified professional midwives kind of don't practice in hospital spaces, and the certification is different. The training is different. It's more focused on home practice. And when I finished in that program and moved back to New York State was like, nope, we don't take that certification.
Oh.
So I went back to midwifery school in 2017, and that's where I got my Master's of Science in Midwifery at SUNY Downstate here in Brooklyn, in the city, and jumped right back into home birth, actually. So I primarily practice in home birth spaces and supporting women in, their lifespan, really, from age 12 to 84. But mostly in pregnancy, we were in the home birth space. So,
Awesome.
yeah.
Cool. What is your favorite part of being a midwife?
Oh man, there's so many things. But I've learned that as I've gotten older, the education has been always like my favorite thing. My mother is an educator, and I come from a family of educators. My grandfather was an educator, and so I guess that kind of fell into my pathway as well. And so for me, the teaching moments that I have as a midwife in the transformations of the pregnancy journey, and just as women are and families are expanding and they're trying new things and considering trying new things, and just, opening their eyes to how to eat better, live better, addressing emotional needs and all of that. Like, that is hands down my favorite part of midwifery.
Yeah, that's awesome. That's super cool. It's definitely really empowering that you're a part of the educational system related to women's health, because I feel like normally people feel so lost and confused and are just sifting through Reddit when it comes to any type of healthcare in general, but especially women's health. So yeah, that's super awesome. Today, I'm super excited to chat with you about nutrition during pregnancy and postpartum as well, and then potentially sex during pregnancy too. But first, would love to get some thoughts on cord blood banking, as we are doing cord blood banking at Anja Health. So as a midwife, what are the pros and cons to cord blood banking for you?
So to me, the only con for cord blood banking is the expense. My background before becoming a midwife is that I was a medical laboratory sciences. So I have a background in transfusion medicine. I have a background in immunology and clinical chemistry. So I do understand there's many pros and how the cells in the cord, those stem cells that are present, can be supportive of either that child or a relative, or, the only con is the costs associated, in my opinion. So, I have had some families that are like, what do you think about this? And I'm like, you tell me. Yeah, that's as far as it goes, really.
Yeah. Okay, awesome. Have you ever done cord blood banking yourself, especially at a home birth?
Yeah. So ultimately, no, I haven't. Well, in a hospital once, we did collect some cord blood for a patient. But in home birth, again, like when people do their research, and I'm supportive of it for sure. I'm like, this is where you can look, you find the kit, you got the kit shipped to us, and we'll collect it. But then when they find out like the storage part, that's typically when they're like, well, we're already paying for this expensive birth. And maybe for some, it's not as expensive, it depends on the insurance. But even those that aren't paying that much for the birth probably aren't paying that much because they don't have money to pay for cord blood banking. So, I haven't actually seen it through for cord blood specimen to date.
Yeah, that's okay. I think it's interesting to get just a lot of exposure to different types of birth stories. There's different opinions on cord blood banking. In the US, only 2% of parents do cord blood banking, but it's actually a legal mandate in 31 states that at least parents know about it as an option. So I think for us, we're just trying to get it to be really at the forefront of thought where at least people know about it, because typically we get so many comments online that are along the lines of like, OMG, I gave birth 4 days ago. Literally no one told me about this. I had no idea there were even stem cells in the umbilical cord and placenta, and it's just thrown away. So I still think it's important to talk about nonetheless.
Yeah, that's fair.
Cool. Well, have you ever done delayed cord clamping and cord blood banking? I guess you said you only did cord blood banking once, but typically we have parents that delay cord clamping anywhere from like not at all to up to 2 minutes and then bank the rest. Or if they do more, they can bank the cord tissue and placenta. How have you seen delayed cord clamping and cord blood banking interact, if you have?
Yeah. So that was interesting to me when I was like reading about it just the other day, that you could just use the placenta. I actually didn't know that. So by default, yes, most of my clients, we are doing delayed cord clamping for not 2 minutes, not 30 minutes, but almost like a full hour.
Oh, okay.
Yeah. So just because like I let them have the first hour uninterrupted, and so it ends up being the hour, and then we, cut the cord. There's very rare moments that we're cutting earlier than that.
Yeah.
Yeah, and so it's good to know that we can just still do the delayed cord clamping and then like get the placenta and the cord tissue for storage if they want that.
Yeah, definitely. Yeah. What are the benefits to delayed cord clamping in your eyes?
So the benefits for delayed cord clamping include completing the perfusion, like transfusion of all of baby's blood. So we know that there are blood left, and cells that are in the cord once baby leaves the womb and they're, transitioning earthside. They're breathing and their lungs are, doing its thing, but there's still blood pumping through that placenta. Even though it's like, to us, a couple of drops, to a little tiny human being, it's a lot, I've seen babies that, or I should say, I've had moms compare their babies that have that hour of delayed cord clamping with me to their siblings that were born in a hospital space where they're just like a minute or no delayed cord clamping. And they're like, yeah, this kid was pale. This kid is nice and rosy. And like, they're like, oh, it just looks so much better. And so you can definitely tell the difference between a babe that has gotten more of their blood volume through the delayed cord clamping and ones that like immediately after birth, the cord was cut.
Awesome.
And for babies that might have medical procedures later in their life that might have been born with a heart condition or something, like it's definitely beneficial for them as well to be able to have that extra blood for also regulating temperature and things like that. So,
right.
Yeah.
That's awesome. Cool. Well, yeah, my last question on cord blood banking is related to this article that UC Davis recently published. So especially with your background in immunology and transfusion, would love to get your initial reactions to this. So basically, they use stem cells from the placenta in order to help treat spina bifida. So this physician said that it was sort of like magic stem cell juice. In addition to protecting the spinal cord, it was able to reverse some of the damage that had been done. This just goes to show, like we were talking about earlier, that you do a lot of delayed cord clamping to a pretty extended amount. We still really want to emphasize the importance of placenta stem cells as well, that parents can bank as an option. So yeah, with your background, what are your initial thoughts on placenta stem cells and this study?
Like I said, it makes sense. It makes sense that, yes, we've got the cells that are in the blood itself that we see coursing through the cord, but we know that the placenta has been carrying life in and of itself as well. And we know that the placenta is used for other things, other research. Some people, there's placenta products in your hair solutions and in cosmetic products that we probably didn't know about. But it makes sense that there are also like those stem cells that are useful for treatment of in this case, spina bifida. I would love to see like live what that looks like in lab, I guess in vitro, what they
Yeah.
recorded of how it's supportive of healing spina bifida. But yeah.
Yeah, that's awesome.
That makes sense.
Cool. Do you have any questions for me related to cord blood banking?
What would you recommend in terms of turnaround time for ordering things and like the family getting clarity about the process? And what's your process at Anja Health?
Yeah, definitely. We typically recommend that parents try to make a decision on cord blood banking by around 30 weeks. And then if they order at that time, then we'll send it to their home. We'll send a kit to their home right away. If they get exposed to our content before, I recommend just doing it, and we don't send the kit in that case until 30 weeks. We try to just make sure that parents don't forget and they enroll as soon as they can.
Mm-hmm.
And if we haven't sent the kit yet, then they can always unenroll with us and we will refund them if the kit hasn't been sent to their home. If they enroll with us after 30 weeks, then we can get a kit to them right away pretty much, especially if they're later in their pregnancy.
Mm-hmm.
Like we once had a mom, I think the latest we've done was she was 4 centimeters dilated.
Wow. Okay.
Yeah. So we have emergency kits stored throughout the United States. So in the case that parents decide super last minute that they want to bank cord blood, cord tissue, or placenta stem cells with us, then we can make that work for sure. Basically, they can just take the kit with them to birth. We've supported some home births as well, and hospital and birth center births too. So yeah, we're available for trainings for midwives if they don't feel comfortable collecting, but typically we have instructions inside and they see it as pretty easy. Like you just stick the cord blood bag into the umbilical cord vein if you're collecting cord blood, and then you can cut off a little over 6 to 10 inches around there of the cord tissue and then the placenta and place them in jars. And then you can call us for pickup and a courier will come to wherever you are, even a home, and bring it to our lab based in New Jersey, which is where we process and freeze the stem cells for parents to use for future disease treatment.
Okay. Have you ever seen like poorly collected
cord
blood specimens?
Yeah, so we have seen poorly collected cord blood specimens. In those cases, we don't charge parents for the cord blood, of course. So yeah, we do try to meet with them right after they purchase. We try to meet with parents right after they purchase because we want to make sure that the specimens can be collected properly. So that's why we have, for instance, our rule around delayed cord clamping only being 2 minutes, because then otherwise the cord blood sample might be too low. We also try to urge parents to remind their provider to cord. And even if they do longer than 2 minutes, like slightly over, if they're milking the cord, then they can potentially get enough cord blood. So we try to do 40 milliliters at least. We can store a little bit less, but yeah, we typically try to get like a good amount of it. So 40. And yeah, we haven't had too many issues collecting the cord tissue and placenta, especially since the placenta is so large. Yeah. We're able to collect stem cells from it anyhow. So yeah, it's mainly just making sure that there's enough cord blood and that there's like real attention to milking the cord and getting enough cord blood volume.
Got you.
Cool. Okay. Any other questions?
No, I think that's it.
Cool. Okay, awesome. Well, I'm super excited to chat with you about nutrition. You mentioned that you're really passionate as a midwife about nutrition during pregnancy, and I know a lot of parents are really interested in like what they can and can't eat. I feel like there's so many rumors around like caffeine, seafood, things like that. What are your main tips if you had to pick 3 for maintaining proper nutrition during pregnancy from your perspective as a midwife?
Okay, 3. First of all, acknowledging that nutrition is like the building block of a healthy pregnancy, a healthy labor, and postpartum period. And that when you provide the appropriate nutritive substances to your body, you're protecting your body from conditions like preeclampsia, gestational diabetes, high blood pressure, but you have to do the groundwork before you get there, not like troubleshooting it after. It's not as easy once you get there. So I always say, your plate should be half fruits, vegetables, whichever version of that you're having, whether it's morning or evening. And then a quarter of it would be carbs and then a quarter protein. But also, I guess that's my third one already. Protein. Protein is really important. Protein is the building block of the cell. And in pregnancy, your baby needs to make cells, and those cells need to actually grow. So once the cell is made, then it also has to expand. Like they're two, developmental parts of cell growth. And protein is the building block of the cell. So making sure that you're having good quality protein in each of your meals is important.
Right. Okay, awesome. Yeah, I've been trying to lift a lot recently, so I've been increasing my protein intake.
And also, good protein intake not only helps baby, but it also helps your liver not have to work as hard. The liver does so much work in pregnancy. It helps push out hormones. It's creating protein. If you don't get enough protein in your diet, your liver has to do that work. And when we have a taxed liver, then we have conditions in pregnancy that we don't want to have. So
right. What kind of conditions do you typically see?
So back at the preeclampsia, we've got fatty liver of pregnancy. We've got HELP syndrome.
Right.
Those kinds of things where your liver's like struggling.
Right. Okay, good to know. What kind of snacks do you think keep you full during pregnancy? I feel like I see a lot of content along the lines of like overeating during pregnancy, especially after you get past nausea. What recommendations do you have, especially thinking about protein intake and things like that you think will help keep you full?
Yeah. Don't eat empty calories. That's like, because if we're snacking just to have something in our mouth because our body is signaling us like, hey, maybe we need some energy because we're doing a lot of work down here. And then we're eating chips or popcorn. That's not going to sustain you for long. So then you're like, I need more, but you're getting all this fat and unnecessary calories that aren't doing much for you. So back to the protein. Protein-based snacks like trail mix, peanut butter and jelly sandwich. Some people live off of boiled eggs in their pregnancy because that's kind of all they can really get down, and it helps with nausea and vomiting. Back in the day,
high in choline.
And high in choline, exactly. Good for baby. So they used to say, like, take some crackers and ginger ale, but that's not actually, that's proven not to actually help with nausea and vomiting. It's actually a protein. So if you got to do a boiled egg, just cook a bunch in the, early part of the day and pop them when I'm protein smoothie, hummus and vegetables, because we're getting raw vegetables and we're getting protein. What else? Then you have like, tuna sandwiches or like a tuna dip or things like that. But there's lots of non-meat options for protein and then meat options as well if you're, a meat eater.
Yeah. Do you recommend that pregnant parents take protein powder?
I mean, I don't recommend it. My preference is to get it from a food source.
Yeah.
But if you are struggling with like, meal prepping or just being able to have it, close by, then yes, that's definitely on the list of, okay, well then if not this, then this is a great option.
Yeah. If someone is pregnant and vegan or vegetarian, how do you help them get enough protein?
Yeah. So then with the vegan vegetarians, we do the hummus, the peanut butter, the nuts if they don't have nut allergies. But if they do have nut allergies, then we have to like do more beans and protein of that nature. And then also whole grains. Complex grains have protein in them, like oatmeal, quinoa, those kinds of grains. So then they'll do more oatmeals in the morning. They'll put oatmeal in their smoothies, or they'll have find some kind of vegan protein powder that they are, that works well. Flaxseed, chia seeds, those things have protein in them as well.
Okay, awesome. Yeah, I've been eating the Jennifer Aniston salad. Have you been seeing that on TikTok?
Actually, I remember that like a while ago. I didn't really cue into it. Tell me about that.
Yeah, so it's chickpeas, quinoa, mint, lemon, olive oil, pepper, and goat cheese is not vegan, but they're like other substitutes. I think that's it. But yeah, it's super high in protein, and quinoa has all of the essential amino acids. So I've been eating the Jennifer Aniston salad probably 3 times a week for like 4 months.
Amazing. That sounds like a delicious salad. And it fills you and keeps you well,
Yeah.
right?
Yeah, I eat it at like
Exactly.
10:30 usually, and then I don't have to eat again until like 6.
Nice.
Yeah.
Yeah, it works.
Awesome. Well, if you could list 5 main foods that you should try to eat during pregnancy that have, for instance, a lot of choline or anything like that that might be essential during pregnancy, what would those main foods be?
So if you're a meat eater, I tend to recommend like the fatty fishes more, like salmon. Eggs are, like I said, like a real go-to and supportive of a lot of things in pregnancy. And then raw fruits and vegetables, a variety of them, different colors. So the leafy greens are good for iron because that is something that in pregnancy we want to like stay on top of, is making sure that we don't have pregnancy of anemia or anemia of pregnancy, excuse me. And that's a thing because at a certain point in the pregnancy, our body's blood volume literally increases. So our body's like, let me make more blood to get to where, you know, it needs to go to this growing fetus. And the plasma portion of the blood is what increases, not the red blood cells. So if like we've got a cup of my matcha here, if this bottom portion was the red blood cells and then there was this much plasma in it before, like in the 16-week period, by 24, 28 weeks there'll be this much plasma, but the same amount of red blood cells. So it's like what we call hemodilution. And that hemodilution is symptomatic anemia. So we've got like, that's when it's like, oh, I'm so short. Like I have a hard time breathing, even when I'm just like sitting down, or I'm super, super, super tired all of a sudden again. And that's because of anemia of pregnancy. I'm chewing on ice chips. I've got cravings to eat or whatever. Those are pica, right? Those are things that pop up in pregnancy. So if we're eating our dark leafy greens, foods that are rich in iron, then we can help to avoid that. And those symptoms kind of drag down a pregnancy, right? Because if mom's not feeling like she's got good energy, then everything feels like a really difficult task. Yeah. And we don't want that. So getting in your dark leafy greens, iron-rich food, fatty fish and eggs, lots of protein. And then also the fruits are important too, the vitamin C fruits. A lot of women crave oranges and things like that in pregnancy because their body's like, give me that vitamin C. And then when we listen, we give our body what it needs to help our body absorb the iron that it needs also for that.
Okay, awesome. So during pregnancy, I know a lot of people talk about eating for 2 and things like that. To what extent should someone eat more than they're normally used to eating?
So it really shouldn't feel like eating for tutu.
Yeah.
I don't know how to explain it other than you need to eat according to your what your body's telling you, not just because I can, because it's based on your caloric needs. So for someone that works a sedentary job, sits at a desk for most of the day, drives their car home, and isn't going to the gym, unlike what their midwife told them to do, they don't need to really increase their calories that much more. Like, you know, there will be parts of the pregnancy that they'll probably need to snack in between meals for sure, but generally not necessarily. Other people that are like on their bikes, going to the gym 3 times a week, running after smaller children, or, you know, walking to the train for like, you know, 15 minutes each way, they will need more calories because their body is literally doing a thing inside, burning calories, making a life, and then they're also using calories as a human. So, but it's like 2,500 versus the 2,000 that is the, you know, what's the FDA approved amount of calories, or typical amount of calories for most people. It's not that much more. And 500 calories is what, like maybe 2 cookies? Yeah. It's not that much more. Yeah. I also do say that if you feel like you are being fueled well by what you're taking in, then you're doing a good job. Right. So there are some people that'll be like, you know, I mean, I eat when I need to eat, but I'm not really eating more than the 3 meals a day that I usually eat. baby's been growing well according to whenever they come in for their assessments. And so my question to them is like, are you feeling like your food is fueling your body for the day? And if the answer is yes, then you're doing a great job.
Right. Okay, awesome. Thinking about your iron recommendation, if pregnant parents feel really out of breath during the day, does eating leafy greens help boost that iron supply and then help them feel less out of breath?
It should. It's not instantaneous.
Yeah.
But once iron does get stored in the body. So if you are low in iron and you have iron deficiency anemia, once you've built up that reserve back, you should be good for like a while, especially because you're going to keep up the good habits and you're going to keep, right? It's not instantaneous, but like if I've seen like good results even for 3 to 4 days.
Oh, awesome.
If you're really like leafy
Eating
greens, beets, you know, iron-rich food, it can help pretty quickly.
Okay, that's a good recommendation. How do you think pregnant parents should best plan their pregnancy nutrition? Like, should they meet with a nutritionist, or do you have go-to guides that pregnant parents should take a look at?
Yeah, that's a great question. In my practice, we do diet diaries together at least every trimester.
Okay, cool.
So my clients get that one-on-one time with me, and we go over and we review. If you don't have a practitioner that's doing that, then I would recommend working with a nutritionist. Just check in, like, you know, a couple of times in the pregnancy, definitely at the beginning, because again, you want to make sure you're planning out to have a good foundation for before things start coming up, right? If your provider is like only seeing you for 10, 15 minutes, just checking the baby real quick, and you do labs elsewhere and you do an ultrasound elsewhere, yeah, go to see a nutritionist. It will really, really, really be beneficial for you.
Awesome. We previously had a nutritionist on our podcast, and she specializes in nutrition for folks with gestational diabetes. So how do you think folks should plan nutrition if they're pregnant and don't want gestational diabetes or might have a risk for it? How do you think they should plan around that?
Gestational diabetes is pretty specific to how our body is processing sugar. For clients of mine that have had gestational diabetes pop up on the radar, we do then escalate to a nutritionist for additional follow-up than with myself. But my counsel will typically be staying away from processed sugar, refined sugars, eating more complex carbs rather than the simple carbs. So like staying away from the white bread, the white rice. But if you have the brown rices and the quinoas that your body needs to break down more, they have a lower glycemic index. And there's certain breads that you can get that have lower glycemic indexes. And you can't eat croissants every day anymore. And not drinking coffee with like milk and cream every morning as much. But definitely lowering that glycemic index from your carb intakes, and also cueing into the fact that I always believe that your sugar cravings are often you actually needing protein. Because your body knows that when you take in sugar, it gives you like this quick boost of calories. Like, I need energy. Let me get something sweet because it's going to give me like shoot up my calorie and energy for that moment. But really, if you were to take in some protein, that's more long-lasting energy and it's more nutritive energy, then you would also solve that problem. So cueing into like, okay, I'm getting sugar cravings. Is it that I really need to have this Kit Kat, or have I not eaten in like a couple hours?
Right.
You know?
Yeah.
And what did I eat a couple hours ago?
Yeah. I'm curious what your thoughts are on muscle milk or things that are protein but like kind of pseudo sugar. Like I've been having a lot of muscle milk since I've been lifting, but it feels not that great sometimes.
What does it feel like? What do you...
I don't know. Like a few days ago, I had a lifting session for probably 40 minutes. And then, I had a chocolate muscle milk after. And I went to sleep like soon after. Like I worked out at about 8, went to bed at 10. And then, but when I woke up the next morning, I felt so bad and low energy. And I wear an Oura ring, so I can usually track my sleep. And I got enough REM and deep sleep, but I just didn't feel well rested, which was really strange. Like usually my REM or deep sleep is kind of off if I'm if I'm feeling not well rested. So yeah, I was wondering if it was because of the muscle milk. So I've been thinking more about like pseudo protein additives.
Yeah. I will tell you that I'm not like a fan of the pseudo protein situation. I don't really know though how much it affects like sugar levels, for instance, because anything that's been created in a lab has removed the things that were made with it to help your body process it. Like, I actually don't believe in egg whites. I believe that you should have the white part and the yolk part because your body needs the fat from the yolk to process so I don't believe in 2% milk because I feel like you need, like, everything that's made a certain way is made that way for a reason. That's my belief. So these protein powders that are made that way, I feel like, they're not necessarily the greatest version. Why it caused you to have an unrest, I'm not sure.
Yeah.
That's something to
I feel
look
like it might be
into.
the sugar. Like there's a lot of, it's supposed to be like 0 grams of sugar, but there's like all these like oses in them. So I don't know. Well, yeah, if you Google nutrition pregnancy, one of the top questions is what happens if you don't eat healthy during pregnancy. I think so many pregnant parents don't know that they're not eating but wonder about the consequences. So what are the consequences in your eyes if a pregnant parent doesn't eat healthy?
Oh man, there's so many things, and that's why I really heavily lean on nutrition as the foundation. To start out, I think the first thing in most people's mind is like the baby, right? Like, what's going to happen to the baby if I don't eat well? Most of the times, in the beginning portion of the pregnancy when organogenesis is happening, which means like the baby cells are differentiating which version of their, which part of the body it wants to focus on. Like, do I want to be a liver? Do I want to be a heart? Do I want to be bone cells? And then the spine forms and all of that. That's like the first 8 to 10 weeks of pregnancy. In that time period, there's 2 schools of thoughts. One is like, whatever's going to happen is going to happen. So like, if you know that you're pregnant and you eat as well as, and take your DHAs and all of that and prenatal vitamins, then great. And if you haven't, whatever was going to happen anyways. And then others are like, definitely have started your prenatal vitamins right away or even before, preconception, have, been eating well and all of that. But mostly after that period, baby's going to take whatever they need from you. Some people refer to fetuses as parasites because they kind of are. They are like, let me take what I need. And mom or the birthing person is the one that gets drained. So you get depleted of calcium, you get depleted of iron, you get depleted of vitamin C because baby's going to take what they need for growing.
It makes me think of Renesmee in Twilight. Have you seen Twilight?
I have. It's been way too long. Remind me, like
when Bella in Twilight has a baby, she like gets really, really skinny because the baby's basically taking her blood.
Like parasite.
Yeah. Yes.
Okay. Yes. So it's not so much baby, but more so the well-being of the birthing person. In that way. Then when you consider like making sure that your liver has a good foundation and doesn't have to work super, super hard, because if you work it super, super hard, it might then be taxed too much and lead to conditions that we already talked about.
Right.
Your kidney also has to do a lot of work in processing all the things that you eat and all the stuff that baby's, pushing out as well. And so you can also overtax your kidneys, and then we've got protein spilling out of the kidneys into the urine, and then that's like one of the signs of preeclampsia, for instance. And so if you're not eating well in the beginning part of the pregnancy, yes, maybe it will affect baby's cell development. If you're not eating well after that period, it's mostly how it affects the birthing person's body and how you're going to manage the pregnancy and if conditions will come up for you, not necessarily baby.
Right.
So what will happen? you might be too tired to deal with your toddlers. You might not be able to continue going to work. You might be short of breath, walking or just sitting down and feel like you can't really go through your day. You might become irritable with your family members or your partner. You might develop high blood pressure, and high blood pressure, that can be life-threatening if you're in labor and your blood pressure is so high that your heart is like, can't do this anymore.
Yeah.
Preeclampsia is also a life-threatening condition that can develop if your liver is too taxed and your kidneys and you don't have proper protein and blood volume expansion during the pregnancy. So a host of things can happen, but mostly it's specific to mom and not baby. I know that's like what people mostly fear is that, like, I'm going to do something wrong to baby. I mean, fetal alcohol syndrome is a thing. That's something like that's totally different. That's alcohol consumption at certain levels in the pregnancy. But food-wise, it's mostly taxes mom's body.
Right. Okay, interesting. Can not eating enough affect your pregnancy? Especially, I think that's a concern for people that experience a lot of nausea in the early stages. What are your thoughts there?
Yeah, so again, back to the protein, right? Building blocks of the cell. Not eating enough eventually can affect the growth of baby. And then we see that can lead to what's called IUGR, intrauterine growth retardation, or fetal growth restriction is what we call it now. And then baby's just not growing appropriately. And then at that point, we may recommend to induce labor by term so that we can get baby out and get them what they need sooner rather than later. But that means that your baby doesn't get to cook in you as long as they should, which is more beneficial than having a 37-week a term induction. So that is a risk of not, your baby not growing, developing appropriately. The placenta also needs to continue to work as a functioning organ. So not eating or developing gestational diabetes, we found, can also affect the placenta because there are these spiral arteries in the placenta that somehow get affected with the insulin rush of when diabetes happens. Somehow those arteries get affected and that the arteries constrict and then parts of the placenta don't function the way they should for baby or, something to that effect. And so poor eating can also affect the perfusion of baby from their placenta. So that's a thing. And then I said gestational diabetes, that can also happen, right?
Right.
And that means that your baby can potentially grow larger than they should in the womb. This is something that would affect baby long-term, possibly, is that baby can be born with a form of diabetes and or develop diabetes. Well, they would be born with possibly low blood sugar because they're so used to having like that excessive amount of sugar in the womb. Then when they come out and they're separated from their placenta and from their source, mom, who was giving them all this sugar, all of a sudden their sugar drops and then we've got like a hypoglycemic baby.
Right.
And they can also develop diabetes long-term in the future if they are born if they live in a hyperglycemic environment in the womb. So
yeah, it's interesting. I read about how gestational diabetes isn't necessarily predictable per se because, like, for instance, it could be in one pregnancy but then not the next. How does gestational diabetes generally come about, and what can parents do to prevent it from happening?
Lifestyle?
Yeah, mainly the nutrition.
Yeah, nutrition. There's families that come to me and they're like, I had gestational diabetes in the last pregnancy and they said that like I'll have it every time after. Is that true? I'm like, no. If we work and are intentional about what goes into your body and how you process and, your movement activity levels during the pregnancy as well, you don't have to have gestational diabetes this time around as well. And I've successfully walked people through that.
Yeah, that's awesome.
Yeah.
Okay, awesome. Well, this is a bit of a more niche topic, but I feel like one subtopic I've been seeing in nutrition a lot recently is around microplastics exposure. Do you have any general thoughts on that? I know there was also an article that came out about finding microplastics in the after birth. So people are clearly ingesting enough plastics that it could potentially even reach the baby
The
in the 9 months
placenta.
of pregnancy. What have you seen around that? Do you think it's something to be concerned about?
I have no idea. I have not done any research around that, but I do know that there are certain things that cross the placenta and go to baby, and so we know that to be true, and so why not microplastics?
Awesome. Well, yeah, that was a really interesting segment related to nutrition. So something else that you also mentioned you were interested in is sex is involvement in pregnancy and birth as well. So you mentioned oxytocin therapy, which I think is a really interesting concept. So yeah, can you explain what is oxytocin therapy? What role does it play within birth, but also outside of birth?
So oxytocin, I call oxytocin therapy basically use of that oxytocin, which is a hormone that our body produces um, to help us cope
Hmm.
with things outside of pregnancy. I guess that could look like, you or I having a bad day and like needing to be feel loved and feel like some kind of joy. So I call
Hmm.
oxytocin the love hormone. And
Hmm.
basically, when we feel sensations of feeling secure and happy, we release oxytocin.
Hmm.
In pregnancy specifically, I talk about oxytocin therapy for just like the whole concept of whatever we experience outside, baby experiences inside as well.
Mm.
So if mom or the birthing person is in a car and someone cuts them off in these mean New York streets, right? And they're like really upset, or they almost get like into an accident maybe.
Hmm.
And they're like, oh my goodness, like how could they, da 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 da. Instead of responding that way for too long, because we are humans and we respond to things that happen in our life, and that's okay. Acknowledging it is important, but then, like I always tell my clients, but go back to your oxytocin therapy. Touch your
Mm.
belly, tell baby, like, okay, we just experienced this, but we're okay. Let's go get some ice cream, maybe. That can be oxytocin therapy because maybe that's what mom needs to feel better. It might be something as simple as like opening your phone and looking at a picture of your other children or your partner.
Mm.
If you like puppy dogs, like, watching a video of some puppies playing around or some running around with each other, those things can be oxytocin therapy. People always jump to like the sex part, but there's other little things that are also oxytocin therapy that can really like calm and settle and make someone feel secure and safe.
Right.
And that's really important because what we want to do is definitely reduce cortisol production, which is that, fight flight hormone transmitter that goes through our body and can cause havoc in many ways.
Hmm.
And so oxytocin therapy like combats the cortisol in that way during the pregnancy.
Right. So do you feel like I think a lot of pregnancy is about hormone regulation, and I feel like that's why nutrition plays such an essential role. So do you think other than nutrition, oxytocin is something that people can kind of tap into while they're pregnant and really be able to help influence their own hormone regulation that way? And do you think it's sort of the most easily manipulated hormone per se?
Absolutely. Absolutely. Like I have I usually say mind, body, soul, like they're all connected. And so
Hmm.
if our mind, we can tap into the power of our mind to help support what our body's needs are, like we're winning 100%.
Yeah. That's awesome. I think it's interesting. There's this Grey's Anatomy episode where one of the physicians, I think, has some sort of social disability. And when she's having a panic attack, she likes to be hugged really tightly because it releases oxy. I found
Man, you have such a good memory, Catherine, because I watch Grey's Anatomy and like I'm like, I don't remember this episode.
she was one of the cardiologists that was training Dr. Christina Yang.
Ah,
And yeah, she
okay,
would
like seasons ago.
Yeah,
Many moons ago.
yes. Yeah, so she wouldn't even because people, her social disability prevented her from liking touch. So she would actually wrap her white coat around her really, really tightly, and it would help release oxytocin. I think it was autism, but I forget.
Yeah,
but
I love that.
So it was interesting when you mentioned oxytocin during oxytocin therapy during pregnancy, it made me think about that episode, but also this article that I found where people are using oxytocin therapy not only to help speed up birth per se, but also to help treat things like autism, because it can help autistic kids feel calmer and sort of reduce their anxiety. So yeah, I always, whenever I think about oxytocin, I think about like hugs and just like really tight embraces and even like heavy blanket. I forget. Oh, the weighted blanket. Thinking about oxytocin therapy for birth, let me see, I forget. Oh yeah. How can sex or nipple stimulation or other oxytocin inducing maneuvers play a role in birth?
Yeah. So a lot of people think that if we have sex, like maybe I'm going to go into labor, before I'm supposed to. And that's actually not typically the case. Unless you are at high risk for preterm labor, most people's body does this really amazing thing where the receptors that need to be filled for your body to be like, okay, contract with oxytocin, they're turned off until it's time to go. So getting oxytocin therapy, having sex, being around puppies or watching videos or whatever is not going to put you into labor until you're in labor. When you're in labor, absolutely oxytocin therapy can help with continuing to, have that hormone surge, and that hormone in labor will cause you to have contractions, and that's what we need to bring a baby earthside. Specifically sex. So, there's levels to it, right? So let's start with nipple stimulation. We use nipple stimulation because the estrogen that basically is needed to push milk out of the duct responds to oxytocin, actually. And when your body's when the breasts are stimulated to think that it needs to produce milk, oxytocin comes first. And oxytocin then leads to a contraction. So
it's the only hormone that pushes forward contractions, or one of the main ones.
Yeah, oxytocin. When labor is happening, not prior to. And so we can do nipple stimulation for many. It does work pretty well. You can do it by hand yourself, kind of like what it would look like if you were expressing milk. Or you can have a partner use their tongue or their mouth, or you can use a breast pump to do nipple stimulation. I wouldn't recommend doing nipple stimulation without the guidance of a provider or a birth worker that can guide you, because you can overstimulate and cause contractions to come back to back to back, which is not good for you or baby. So it does have to be monitored and possibly titrated, but it is something that we do use for bringing on labor or helping it to come closer, contractions to come closer together. Then there's the sex thing. And sex does two things. Sex can bring on the oxytocin, right? Orgasm can bring on oxytocin and help the body relax, as well as bring on those contractions that we need. The other thing that sex does is it can provide, and this would be sex with a male partner using semen. That semen will actually go up by the cervix, and the prostaglandins from the semen will actually soften that cervix and help your contractions be more efficient. So actually in hospital spaces where they're doing an induction, a lot of hospitals will start the induction with something called Cervidil. Or some people have heard is the one specifically that I'm talking about. Cervidil is like an insert that we put up right by the cervix. And what's inside of Cervidil is semen from a horse.
Oh, wow. I didn't know that.
Yeah. So we can get human semen from our partner to do the same thing. Why not?
Yeah.
And like I said, the goal of that semen is those prostaglandins soften up the cervix. So we want your cervix to be soft like your lips. Usually it'll start out hard like the nose. And then when we're at a good place for labor to start, we want it to be soft like our lips. And
Right.
so if we've got contractions working on a hard cervix, they don't work as well to open the space and, you know, give us good dilation. But if it's soft, then the contractions will work efficiently.
Okay.
So that's the other thing that sex does for us in labor.
Yeah, interesting. So if sex can help with labor, if you're a single parent or a gay parent as well, how do you recommend using sex or even like masturbation as a coping mechanism for birth?
Yeah. So you won't get the semen part, but you definitely can get the orgasm. And the orgasm does a great job in also softening up the cervix. And just like release of tension all over the body is super, super helpful for a labor process, whether it's early on or at the very end or in the middle. I always tell my clients, like, imagine that your body is all connected and that your uterus is kind of like the shape of a bottle, and at the bottom of the bottle is the neck, and that's the cervix. And so everything actually needs to be soft in order for baby to make their way down. If we're tense, we kind of hold things back. And so an orgasm does wonders for people that are like experiencing lots of tension or like emotional about something and needing a release in order to let the labor go forward.
Right. So if you're a single parent, would you recommend masturbating in labor?
Yeah. Why not?
Okay, interesting. So thinking about preparing for birth in general, how can you prevent tearing during birth, and could sex play a role? For instance, if you're doing massages or anything like that, I know a lot of people recommend warm towels and just opening up that area, especially in the second stage of labor. So yeah, do you think that that kind of massage could potentially be sexy in a way and help prevent tearing, or what are your tips?
So I don't recommend jumping into perineal massage during labor. If you're going to do perineal massage, then you should be doing it prenatally, because it can be not comfortable. It's kind of something that you build first. When you're doing perineal massage, you're first kind of like applying pressure, so to speak, to the corners of the vaginal opening. So you're putting pressure for a couple of seconds on one corner, then you move to the next corner, next spot for like, I say like 10 seconds. You just hold. It's not an actual fluid massage at first because it can be painful. It's like these are muscles that have never had that weight and pressure on it. So like with sex, if we're talking about sex with, you know, a male and a female, that is the penis penetration doesn't put weight on the perineum. It goes further into the canal, and, you know, that's a whole different kind of sensation. The pressure on the perineum only comes from like specific application. So I wouldn't say that sex will help with the perineal massage in the way that we typically tell one to do it. But, I mean, you know, maybe it does help keep things loose down there if you're regularly having sex. You know what I mean? In terms of tearing, though, specifically, I would say, yes, you can do perineal massages. I typically will say start them around 37 weeks. Don't do them like from the beginning of time because again, they're not really comfortable, and you don't have to be doing them for 5 to 10 weeks straight. Like a couple weeks of doing it consistently, or even 10 days of doing it consistently, goes a decent way. The other thing is when you are in your pushing phase of labor, yes, warm cloths help. If your provider isn't using a warm cloth at the perineum, or you're not in a water birth situation, you can maybe request, like, can you apply some pressure with a warm cloth? Is there any, I mean, in the hospital spaces, there is a sink and there are, you know, things that they can use to put warmth on that area. Some people will say like, oh, no, I don't want like my provider to be down there. But if you want a hands-off approach, make sure that you are listening to your provider, so that when the baby's head is crowning, you're not like doing a big push and they're just like flying through your perineal space, because that
Yeah.
will lead to a tear. So make sure that you're tuning into your provider, not all of the 50 other voices around you. Like everyone's like, push, 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 when really you need to pause, pause, pause. And sometimes I've seen that happen. Just wait and listen. Take your time. Breathe your baby down. Let your baby's head stretch the tissue slowly. So even though in that time of pushing, you feel this thing called the ejection reflex, where you're like, I gotta get this out, I gotta get it out, like breathing baby down and remembering that baby is gonna give you a nice slow stretch, and that slow stretch is gonna help prevent tearing, and then listening to your provider. The other thing is nutrition, again. Making sure that you have good, strong, healthy tissue by way of vitamin C, vitamin A, vitamin E. These things are supportive of strong tissue. If we have poorly perfused tissue, or tissue that's what we call friable, like it's just like it will melt away basically with the touch or with extra pressure, then you're gonna tear. But if you're eating well and you're getting those things into your body, then you are really, really going a long way with decreasing the risk of tear. Sometimes we can't avoid it. Sometimes babies come with their little hands next to their head and they're like, phew. And then, you're like, kid, why'd you do that to me? Like, wasn't me, that was you. But if you, do all the things to avoid, then you're at a good place.
Yeah. Okay. Awesome. I think a lot of people, when they think about sex after birth, they think about pelvic floor therapy. So what are the signs that you might need pelvic floor therapy? And do you think sex actually does play a role in that?
Does sex play a role in needing pelvic floor therapy, like prenatally?
Or I guess postpartum.
I mean, I think that definitely if one begins having sex and you're feeling a lot of discomfort with sex, we call it dyspareunia is the medical term, pain with sex, that's a sign that you need an assessment for sure. If you're
for pelvic floor
therapy, right? If you're feeling like you're, not holding as well, or it just doesn't feel as pleasurable, then that's a sign.
Incontinence.
Incontinence is another sign for sure. That's hopefully without sex.
Yeah.
But yeah, incontinence would be a sign. A weak abdomen. So we call it a diastasis recti. Separation of the abdominal muscles is separation of the abdominal muscles, but also is connected to your pelvic floor strength. So seeing a pelvic floor physical therapist for both will be really, really necessary. But that's one sign. You just feel like everything is in there. And yeah, that's how it's going to feel at first. But if that feeling continues for, 6 weeks and on, then there's something that's not, well. Constipation is also a sign of constipation. And you're eating well, you're drinking lots of water, because that's a problem in postpartum, is like we don't get hydrated enough. But if you're doing all the other things well and you're still having constipation, that's a sign that your pelvic floor, there's some kind of misalignment there.
Okay.
So, I mean, I really do recommend pelvic floor therapy regardless of whether or not you're feeling things. Like, just go get an assessment and some additional support to get things toned up for a good outcome for like the rest of your whatever that looks like for you, if it's another baby or if it's just like being a woman and not having to run to the bathroom after a sneeze or a cough down the avoiding prolapse and things like that. I just recommend it for everyone postpartum.
Yeah, it's interesting. Like most of my friends are in their early 20s. I'm 24, but like probably half my friends have done pelvic floor therapy at some point. So I think it's not even a postpartum thing to need pelvic floor therapy, and it should just be like normalized as a part of like general exercise and wellness.
I think that's great.
So yeah, my last question for you is, what is your number one tip for preparing for sex after birth? I know that tends to be something people feel wary about or have anxiety over.
Yeah, that's a great question. I always say listening to your body is important and not feel guilty. Having conversations with your partner and with yourself that it's okay not to be ready right away. If you don't feel ready right away, doing small things to kind of test the waters for yourself, which means maybe that's like just cuddling first, and then maybe just kissing, and then maybe touch without penetration, and then, graduation, or just even spending time together one-on-one. Making separate time for each other is important sometimes for people. And then there's some people that are like, week 4, I'm ready to go. And their partner's like, oh my God, are you sure? Which is usually, not the normal thing. They're like, no, you got to get checked out by your provider first. But in regards to that, once the bleeding has stopped from the uterus, once we're not seeing bleeding anymore, that means the womb is closed up. And you are safe to really probably have sex by then, as long as you haven't had any tears. That needs, some people have no tears during their process of birth. And then once the womb is closed up, you can begin to have sex again if you feel comfortable.
Right.
Or you can just wait for your provider to give you the thumbs up, but most likely it'll be fine. And if you don't feel ready, then be gracious to yourself and take little steps. Maybe it's even just like focusing on you alone, like self-pleasure first for a little bit. And then you might feel ready to be intimate with your partner.
Right. So how soon should you prepare to have sex after birth? Or how soon can you have sex after birth?
Well, like I said, once the womb's closed up, meaning the blood has stopped, which ideally, at least by people may start having sex as soon. But a lot of people are like, I don't want to do that. So, okay. It's individual, but let's say sometime between 4 to 6 weeks after pregnancy. Usually people go with the 6-week mark because that's when they see their provider, and the provider's like, yeah, everything is clear, everything's good. Especially if you have had a tear, you want to make sure that it's well healed before introducing anything, any penetration or anything like that. But usually people go with the 6-week mark, and then anything after that is really based on you emotionally being ready.
Yeah. Is there any time during pregnancy that you shouldn't shave, like leading up to birth or after birth even?
Shaving is fine. You do need to make sure you do it in the most not sterile but clean way, because you can get like folliculitis from razors that are not clean or have like rust in them or something like that.
Right.
And that's not safe. But with clean razors, you can shave. People wax right up until like their due date. I don't know how. Wouldn't be me, but like, yeah, you can wax and shave right up until.
Yeah, but not laser.
No laser. Yeah.
Okay, awesome. Well, this was a super insightful conversation. I'm really, really grateful for you taking the time to chat with us today about nutrition and sex. So yeah, thank you so much for being here.
Thank you for having me. It was a pleasure.
Cool.